First off, what are the SDGs and why are they important? The Sustainable Development Goals are a collection of 17 interlinked global goals designed to be a shared blueprint for peace and prosperity for people on the planet, now and into the future. The SDGs were set up in 2015 by the United Nations General Assembly and are intended to be achieved by 2030.
Today we're going to talk about the third SDG, also known as Good Health and Well-Being. SDG-3 aims to ensure healthy lives and promote well-being for all at all ages. Health and well-being are important at every stage of one's life, starting from the beginning. This goal addresses all major health priorities: reproductive, maternal, newborn, child and adolescent health, communicable and non-communicable diseases, universal health coverage, and access for all to safe, effective, quality and affordable medicines and vaccines.
What are all the goals treated in SDG-3? Maternal mortality. By 2030, reduce the global maternal mortality ratio to less than 70 per 100,000 live births.
Neonatal and child mortality. By 2030, end preventable deaths of newborns and children under 5 years of age, with all countries aiming to reduce neonatal mortality to at least as low as 20 per 100 live births, and under -5 mortality to at least as low as 20 per 100 live births.
Infectious diseases. By 2030, end the epidemics of AIDS, tuberculosis, malaria, and neglected tropical diseases, and combat hepatitis, waterborne disease, and other communicable diseases. Non-communicable diseases. By 2030, reduce by 1/3 premature mortality from non-communicable diseases through prevention and treatment, and promote mental health and well-being.
Substance abuse. Strengthen the prevention and treatment of substance abuse, including narcotic drug abuse and harmful use of alcohol. Road traffic. By 2020, halve the number of global deaths and injuries from road traffic accidents.
Sexual and reproductive health. By 2030, ensure universal access to sexual and reproductive health care services, including for family planning, information education, and the integration of reproductive health into national strategies and programs.
Universal health coverage. Achieve universal health coverage, including financial risk protection, access to quality essential healthcare services, and access to safe, effective, quality, and affordable essential medicines and vaccines for all. Environmental health. By 2030, substantially reduce the number of deaths and illnesses from hazardous chemicals and air, water and soil pollution and contamination.
Medicines and vaccines. Support the research and development of vaccines and medicines for the communicable and non-communicable diseases that primarily affect developing countries. Provide access to affordable, essential medicines and vaccines for all.
What can you do to help achieve this SDG? SDG-3 cannot be achieved without considering the other goals. We must address the core determinants of health and well-being, including socio-economic determinants, such as education, income, and gender. But there are some possibilities that can be done.
Find an SDG charity you want to support. Any donation, big or small, can make a difference. Vaccinate yourself and your kids, protecting your family from diseases also aids public health, promoting altruism, increasing support to mental health.
Over the last 7 years, the number of childhood deaths has been cut in half. This proves that it is possible to win the fight against almost every disease and achieve our goal. We are spending an astonishing amount of money and resources on treating illnesses that are surprisingly easy to prevent. This goal for worldwide good health promotes healthy lifestyles, preventive measures, and modern, efficient healthcare for everyone. This is why it's important to promote good health and well-being.